Welcome to this week's episode. This week and this month, we're talking all about partnerships. And today, we're diving into 4 causes of dental divorce. And I feel like that's a term you labeled, Bob, of dental divorce, but
It is, yeah.
it
But that's what it
definitely,
feels like. In fact, people that have been divorced say a dental divorce is even worse.
yeah. Well, not to discredit those that have gone through a real divorce, but it
This
can
is
be
true.
painful
Yes,
for
it
sure.
can be, yeah.
The 4 causes that we're going to dive into that we see affect more dental partnerships than any other are the following 4: misalignment in how we spend and use money, misalignment in values, a misalignment in how we practice dentistry, and the inability to communicate and solve problems together. Those are the 4 causes of dental divorce. Okay. There's lots of different things that go into each of those, but let's break them down real quick. So, Bob, why do we say the first one here is a misalignment in how we spend and view money?
Well, it's just like any really intimate relationship. Money itself becomes a enormous factor in terms of how we view each other through the lens of trust. And you'll notice that every one of these have this thread wove throughout them, and it's trust. Do we trust them or do we not trust them? And divorces happen when relationships fracture and trust is absolutely shattered. One of the fastest ways that trust can be dissolved in a partnership is when money isn't being used according to the ways that they'd agreed to, um, or according to the ways that both partners feel is in the best interest of the partnership. One partner may go to a trade show and find a device that they just fall in love with and they can't help themselves and they sign up, come back home and they just made a $50,000 commitment. Um, uh, if you did that in a marriage, that would be a real problem. Okay,
Yes, it
and
would.
the same thing happens in a dental partnership. It's so important that how the partners both view and use money is in alignment so that again there's trust.
Yeah. I think
Okay.
one of the underlying things here that wasn't said is having an expectation of how we're going to spend money from the very beginning of the partnership.
Hmm.
Just like in a marriage, you and your spouse probably have rules and outlines of if there's a purchase over X amount of dollars, we need to talk about
Exactly.
it together.
Hmm.
And here's kind of our assigned budget of what we want to spend money on. And lots of times partnerships don't do that. And then they start to get really ticky tacky and nitty gritty and pinching pennies and saying, how could you spend money like this when I don't spend money like that? And then when it's time to give raises or purchase new equipment or upgrade whatever needs to be upgraded, it starts to cause a lot of tension. So
Correct.
that's number one, misalignment in how we spend and use money. Number two, a misalignment in values. A misalignment in values can mean a lot of different things, but to me, it really just comes out down to how we view life and relationships and how we treat others.
Hmm.
And there's not any judgment coming from me. Some people prioritize making more money and having more money, a higher value compared to maybe someone that prioritizes spending as much time as they can with their family. If you have those two people in a relation in a partnership, you have one that just wants to make as much money as they can because they get a lot of energy from that. That's where
Hmm.
they find pride. And the other person's like, I just want to spend time with my family. There starts to cause friction, right?
Correct.
Because one person's always going to be trying to get out and go spend time with family, while the other one's putting the pedal to the metal, trying to get and earn more as much as they can. So,
Hmm.
uh, what are some
And,
other
and 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 to amplify that even further, Brighton, I mean, you also have a situation where that partner who wants to make more money, just to use a hypothetical, is also the partner who's spending more time in the practice.
Yeah,
Okay.
that
They're
is true.
looking at the numbers, they're putting together the HR manual, they're doing all this stuff, and the other partner is just kind of off, just lollygagging around, enjoying what's happening, and sometimes semi clueless.
Yeah, for sure. Number three, misalignment in how we practice dentistry. Now, this is an interesting one because for those from the outside looking in may think all dentists do the same thing, and
Hmm.
that's just not true. When you break it down, there starts to become so many more niche specialties and ways that we
Hmm.
practice, equipment that we like to use, and ways that we like to, prescribe treatment, and how do we fulfill those treatment options and things like that. And dentistry is for sure a science, but there's a lot of different ways to get from, A to Z.
A to B. Yeah, there is.
Ways to skin a cat, whatever you want to say, right?
That's why medical and dental practices are still called practices.
Yes.
Okay, and I know that may seem odd as a patient because you're thinking, oh my goodness, they're practicing, but there's both a science and an art that's being used every time a dentist goes in and starts to work on a patient.
Yeah, and so a natural thing that tends to happen, especially if you have a younger partner, a younger associate that's come into a practice and you have a more
Hmm.
established one, that younger partner is often trying to figure out how they like to do dentistry. And sometimes that comes with experimenting or pushing limits in this way or that way. And as the more senior partner, it's very easy for you to sit back and say, man, how could they do that? Or why would they do it this way? I can't believe they offer that treatment or whatever it is. And it starts to cause these rifts. We see it all the time. And as soon as you stop trusting each other's dentistry, it just
Hmm.
becomes a ginormous problem for you, your practice, and your team members because they're feeling torn in between. And then when it really becomes bad is when the patients start to get affected. And we're
Yeah.
calling patients back in and we're retreating. And, anyways, it can cause a lot of problems if you're misaligned in how you practice dentistry. So, just a quick
And that
tip.
doesn't mean that you have to be exactly the
No,
same.
you don't want to be carbon copies either.
You don't. You can each carve out your own special niches. One can do sleep and TMJ, and the other one can do implants. I mean, that's all fine, but it really again boils down to, do you trust the work that he or she is creating in the end? Can you back it and say, you know what, I trust what they do and it's as good as mine
Yeah.
or
So a
better?
quick, so a quick tip: if someone's listening to this and they're starting to feel some of these feelings, like I just don't know if I can trust the dentistry they're doing, here's a suggestion that we recommend to our clients to put into practice. We do something as simple as what we call chart reviews. Basically, a formal like lunch and learn together as dental partners. Take your best and worst case from the previous month, come together and share what you did well, what you could have done better, and actually ask each other how you would have done it differently. It starts to create this dialogue amongst each other and the partners so that they start to trust and understand each other's dentistry that much more. So that's just a quick tip if you're dealing with some of those pains in your partnership.
Hmm. Hmm.
Okay, the fourth one here: the inability to communicate and solve problems together. Dentists are historically conflict
Risk
averse,
averse, conflict averse.
right?
Yes.
And so working through problems, uh, I can think of 3 or 4 off the top of my head in the last like 3 months, Bob, where people came to us and said, I'm having problems in my partnership or my new associate, and I just don't know what to do. And all we have to do is ask them to go to dinner and actually talk to each other. And the problem is solved. It's amazing to me how much we avoid having like the tougher conversations, and it ends up leading to way more difficult and challenging conversations down the line because we avoid
Hmm.
like the short-term pain or the
Hmm.
uncomfort that's there.
Yeah, I love the phrase you use, Brighton, to lean into the danger. Okay. And yes, 80% of dentists are personalities that really avoid conflict. Okay, they love precision, they love perfection, they are indirect communicators, and they also, avoid risk. And with that type of personality, what happens then is when you start to see things take place, you just start to stuff it in the backpack. Okay, and then the backpack gets heavier and heavier and heavier, and it really becomes a drag on the partnership, on the team, on all the dynamics going on. And I just think about this one uh, doctor that we had met back in November at the course that I teach for Gordon Christensen, working with a brother-in-law for the past
Yeah.
4 years. They'd never sat down and talked,
Nope. Yep.
and they were just starting to just feel the tension more and more and more. And the suggestion at the very end of the course was, listen, why don't you just sit down with them, go to dinner, and use this phrase, which actually is something that marriage counselors recommend. It's called IFAB, and it just means I feel blank about blank because of blank. And you just fill in those blanks. No one can argue with you about your feelings or emotions, and try to open up a discussion so that the two of you actually can begin to reunite. And lo and behold, things started to get better because they started talking.
Just started talking.
And just to realize, and here's the problem with this whole idea of avoiding conflict. You never can avoid conflict.
Nope.
Okay, you can sidestep it, you can go underneath it, but you know what? Eventually, it's still going to be there.
Yeah.
So isn't it better to try to talk about it on your own terms, in your own way, when emotion isn't at this boiling point? And sometimes, frankly, if like the father and the son that we had talked with last month, that were just at loggerheads with each other because everything in the relationship was so unclear, sometimes you have to pull a third party in to help bridge that gap and bring things back in.
Yeah. So we could continue the conversation for a very long time, but we'll leave
Yes,
it
we
at
could.
that. Those are the 4 causes of dental divorce: a misalignment in how we spend and use money, a misalignment in values, a misalignment in how we practice dentistry, and the inability to communicate and solve problems together. This last tidbit for you: if you are a dental partnership, I highly encourage you to treat your business like a business and have business meetings with your partner. Go to dinner, go to lunch, whatever that needs to look like for you, talk to them and make it more often than like once in every 5 years.
Mm-hmm.
Seriously, talk to them. So, if this was of any interest to you and you would like to learn more about working with Dentist Partner Pros, please check out dentistpartnerpros.com. We'd be happy to set up and get to know you more and learn how we might be able to help you further your dental business. Thanks.